So, as I said, think holistic, but you must also think your limits. So what is my strategy? Do I have the right technique for the strategy I would like to apply? It's like cannula, is it needles? This is not a quality issue, but it is a technical issue. You need to be confident with the strategy that you are using. It's like if you're eating knife and fork or chopsticks, you need to be secure in what you do. It's not very nice if the sushi drops down when you eat with chopsticks and you don't have any experience with chopsticks, right? So, strategy versus technique. Have a shared mindset with your patient. You need to explain the patient why would you treat the cheekbone area if she comes into your office and would like to have the nasolabial fold treated. A lot of patients, they will say, it doesn't make sense. It does make sense, but you are the one to explain what is the patient's needs, what are the techniques and tools that I have in order to achieve a holistic approach and a result which relies on that holistic approach, and is it really leading to patient satisfaction, which is crucial. Patient needs to be satisfied or you lose them. As I said, first thing first, we know all those patients walking into our offices and say, "Doctor, I would like my lips done." Well, you can go ahead and do it, but you should be aware that lips should never be the first area to treat. Of course, if you have a 20-something-year-old patient where there's no aging process at all and she really wants to have only her lips done, you can assess that. If the rest of the face is fine, you can do lips, of course, but the lips go together with the rest of the face. One thing in common, they all have dominant chins. You can go from left to right, from right to left, you always say, yes, those are dominant chins. So the chin is a very important part of the face. Is it different in women? Actually, it's not. Also, women have dominant chins, but with a big difference. They have a slim and thin neckline. And you can see that, I mean, although Nicole Kidman overdid it, she's not looking that way anymore, but she's the only one with a slightly pointed chin, and to our aesthetic feelings, it's not as nice as the other ladies, right? So this is what I told you. The eyes only see what the brain knows. You don't see your ears in everyday's life. You don't see your profile and you don't see your back. It's heavy. So what happens if I add more material in a lower face before restoring it? Exactly, it becomes more heavy. Everything will sag even more. Although the nasolabial fold will improve because we treat it, but the lower face will sag more and will give the patient an impression of being even older after your treatment, if you look at it the right way. So, as aging starts in the mid-face, address the mid-face first. Restore that bone structure, restore that fat tissue, and think of skin quality. Treat the skin quality as well. And once all that is restored, then think of treating the lower face. These are the products that we would use in the mid-face and nasolabial fold. This is all on label, and that's the indications that we can use it for. So, before we come to the treatment, I'd like to walk you around the aesthetic medical part that we have applied. It's a very nice result. That's another case in her 50s, very deep nasolabial folds, absolutely no more structure in the cheekbone area, no zygomatic bones almost there anymore. In her case, she had an accident. She was bitten by a dog and the whole face was scarred. So the surgeon performed a very, very nice job there, but that was very hard to treat with hyaluronic acid in order not to highlight the scarring situation. Sorry. And that's her after the treatment. I think a big improvement as well, looking fresh. All these pictures, by the way, are right after treatment in that case, so there's no Photoshop, nothing applied there. That's her from profile. And there you can see it even nicer. We just remodulated all the structures again. She has a nice zygomatic. What we all waited for, that's what everyone wants.
I just encourage you not to see lips only as a structure. Be aware that lips is so much more than just lips. Lips is anatomy, and it's not easy. So I tried to show you some structures on the lips
to understand before treating them, and to understand what would happen if you would apply product to the wrong place of the lips. And this helps me all the time in reminding me, okay, it's different when it comes to upper or lower lips. So what happens if we treat this part with fillers? We're gonna have exactly those kind of things that we don't want. We have the Joker smile, we have heavy, overfilled lips. This is because there is no structure to put the filler on. There's no adequate layer to fill up. So respect those areas. Slightly shorter than the upper and the third. But it gives us and it shows us where we would end up. We know that someone with a very short lower face tends to have a round face. So everything we want to do, we just don't want to highlight the round face. Then if we look at her face shape, she has a beautiful triangle oval face, which we consider as the aesthetic perfect shape of the face. So everything we're going to do on her should be highlight the shape that she already has. So, it's working. So everything we do should highlight the natural face, the natural form of her face, the natural shape of her face that she already has. So when we start, as we said, from the upper third, which in her, or the mid face, the upper third of her face, this is the entry point. I always do it in the direction where I want to go with my cannula later. Cut the skin on my way out, so the entry point is really big enough. Using the volume plus first with the blunt cannula 25 gauge. I always prime my cannulas before entering. In general, the cannulas show you where they have the aperture. This one does not, so I have to assume where it is. I always explain that I feel 3 clicks on my way to the bone. The first click is the dermis, the second click is the ligament.